Okay. I posted another person. I posted these videos about how you make the video recording of your presentation, and also how you can share the presentation here. And I also posted. Mute. Yeah, I need to mute everybody. Yeah, when you have questions, you can unmute yourself. You can speak up. And this is very important document. Writing project instructions. I'm gonna explain this one. And then these are the research materials we have used. And you are familiar with that. But this will facilitate your writing project. I meet all. So hold on. The video presentation will be due next week. Once you are done with the recording, you post it in your YouTube account, and then you share your video in this forum. So here you just add a new topic and then post link to your video in this forum. And then also don't forget to submit your slides. You need to submit your presentation slide in this folder. If you're working in groups, suppose if you're working in a 3-person group, each group will need only one submission. One slide will be sufficient. But you will need to indicate all the authors. You list all the authors in the submission. And then in the week 10 will be the due, the Sunday by midnight, week 10 will be the due date for the final paper submission. I just submit here. Now, let me start talking about the writing. Now, you want to download this document, writing project instructions. Yeah. Writing product instructions. I'm going to open it. Hopefully everybody has come in. This is a document you are using to do your writing. Yeah, well, I'm talking about the writing. See this manual, this writing manual is posted in the portal, this week's section, and everybody should download it. I'm going to explain that. This, when you are doing the writing project, basically, you are going through the whole process of scientific research. And we're going to go through all the steps. Remember your research. What's the first step? Research question, research issue. And then once you have a research issue, you develop your theory, and then you do an empirical observation. You do the study, experimental study, or correlation research, or naturalistic observations. And then basically in the study, you collect data. Remember, we collected quite a bit of data. You analyze the data, and then you draw your conclusions, and then you publish it. So we're not going to publish the paper, but we will try to write a paper as if we're going to publish it. And it goes to the literature. Here is a basic structure of your paper. Well, after you finish your paper will have several components. First, you will have a title page, the AP style title page. I will explain that in a minute. And then you will have an abstract, AP style abstract. And then you have your main body. So these are the the first part is a title page, of course, and then you have abstract, and then following the abstract, you have the main body of the paper. The main body will be the bulk of the paper. You explain the details of your research, and this is the longest part. For the APA style title page and abstract, you can, I'm providing a template. If you go to the portal, you can see that the APA, American Psychological Association, they provide a lot of good sample papers. And you can use this one as a writing template. Let me see where I posted, where I have that in my folder. While writing, oh, here. This is an APA title page, how it look, what would look like. You have the title, you have your, this is author, and then you have your affiliation, the course number, and then, well, it's a me, will this be me, the professor's name, the date of your writing. You can use this as a template. And the sample paper also give you a template of the abstract. Basically, the abstract is a synopsis, is a summary of the whole paper. You summarize what you are studying, how you did the study, what are your key findings, the key results. And then you have a couple of keywords that be handy. And then following the abstract, you have the main body of the paper. And you divide the paper into several sections. And for each section, you have a section heading or a section title. And then lastly, at the very end, you will have the reference section. The APA reference, APA style reference section. Well, we don't have this appendix, but we will have the reference. That is the template. Now, let's talk about the main body, the major part, the most important part of paper. In this part of paper, well, the first at the beginning, you make a statement of your research issue, research question. And the main body of the paper basically follow the same sequence or follow the same order of the research project. First, we always start with a research issue. Remember, what was the research issue we were trying to study in the demonstration we did in the classroom? When you are doing the research issue statement, you first want to identify the major variables. What variables are we investigating in the study? And basically, a research issue is composed of the key variables. And we're asking about the relations between the variables. First, the first concept is persuasion in health psychology. So we're studying persuasion. Persuasion is a key word. Which part of psychology study persuasion? Anybody? No? Is it about memory? Is it well, persuasion? Is this topic discussing memory or biology or cognition or developmental psychology? When you're doing a literature review for your paper, what part of psychology would be you'll be looking at? Anybody know what field or what subfield of psychology would be interested in persuasion? Hello, Rosa. Rosa, we are talking about the writing project.
Hi, sorry, I'm having some technical difficulties.
All right. So this writing manual is posted in the portal. You should download it and read it closely.
All right, thanks.
So the first concept covered in your paper is persuasion. Persuading. We're trying to persuade people to get flu shots, and that's related with persuasion and related with health psychology, and also related with behavior modification. We are trying to persuade people to change their behavior. And this concept, persuasion, is related with the social psychology. Social psychology study persuasion intensively. And what is persuasion? So you know where to look at. Maybe you want to search in a social psychology textbook. If you search a social psychology textbook, Introduction to Social Psychology, they will have a chapter on persuasion. And they gave you the definition of persuasion. Persuasion is related with attitude. And you want to also search for attitude, give a definition of the concept of attitude and attitude change. We are trying to study in our project, we're trying to study the attitude towards flu shot, getting flu vaccination, and how we persuade people to have a positive attitude toward flu shot. And then in order to understand, in order to kind of frame your research issue, in order to explain your research issues closely, you need to review some of the theories, current understanding of this issue. Basically, a literature review will tell you what is a current psychological research, or what is a current best understanding on this issue. And we want to build on top of that.
I'll shoot him an email as well as shoot him a text.
Guys, mute yourself.
Yeah, City is not I'll try to get something for the afternoon.
All right, so you want to review the major theories in this area. And if you do a literature review on the social psychology of persuasion, you find out there are several important theories about persuasion. One theory is the BAM theory. BAM is a psychologist. He has a theory of self-observation. So his theory believes that what you do determines your attitude. Remember, when we were doing the study, let's see, let me show you another document I posted. The research materials. When you're writing the paper, you probably want to refer to this research materials. So most of you have it. Most of you have the questionnaires you completed, but I'm posting it here again. Let me open that. Not this one, actually. It's a different one. We have version A and version B, and they are identical with some subtle differences. So here, one question asks you about your behavior. Have you received any flu shot over the last 4 months? Yes or no? So this question asks you about your behavior. Have you done that? According to the BAM theory, the self-observation theory, this behavior will determine your attitude, actually. So if you have gone through the vaccination, I've been vaccinated, I got the flu shot, and I will be, well, if I have done that, I will have a positive attitude to getting flu shots. And if I haven't done that, I will have a less positive attitude toward getting flu shot. So my attitude toward getting flu shot is influenced or even based on my behavior. If I have done that, it must be important. I must have a strong commitment to that. And then, so behavior influences your attitude. That is very important theory about attitude. Another theory related in attitude and behavior is so-called the cognitive dissonance theory. Anybody remember what is the cognitive dissonance theory? We covered this one in social psychology in 104. Remember in psychology 104, the last topic was on social psychology. And one of the most important part of that chapter was the cognitive dissonance theory. Anybody remember the cognitive dissonance theory? Or Fastinger? You have to look it up. This theory says that, suppose, well, and a very simple example would be that so-called forced compliance. At the beginning of the pandemic, people are against wearing face masks. Many people they don't want to do that, but then they don't have a choice. If you remember, for some period of time, if you don't wear a face mask, you can't go anywhere. You can't get into a movie theater. The movie theaters are closed anyways, but you can't even get into Walmart. Walmart requires you to wear a face mask, and then you don't have a choice. So you are forced to change your behavior. Once you have changed your behavior, you start wearing face mask, you feel better about it. Before you were forced to wear a face mask, you feel that, oh, that's very awkward. I can't breathe. How can you breathe through a face mask? But then after you're forced to wear it, and then you find out it's not so bad. It's okay. Actually, it's better if I wear a face mask. Maybe I don't have to worry about my makeup that much. Maybe I don't have to worry about how I look in my face. And then your attitude changes. The idea is that you try to match your attitude with your behavior. When there's a mismatch between your attitude and behavior, there's a dissonance. The dissonance, well, makes you feel uncomfortable. And Fastinger says that when you have a dissonance, when your behavior has a mismatch with your attitude, you have a high arousal, you feel unsettled. And then what do? You change your attitude. And these two theories believe that behavior influences your attitude. On the other hand, some other theories believe that attitude influences your behavior. And you want to do a literature review and understand this topic. It's really related with what you're going to write about. So another concept investigated in the study, in the paper we're going to write about, is the framing effect. Framing, how you frame the message. There's a positive framing and negative framing. In your literature review, you want to find some information about this topic. And the framing effect is related with loss aversion theory. Loss aversion theory is proposed by Daniel Kahneman, the Nobel Prize winner. He believed that people are more sensitive to loss. And I tell that if you don't get a flu shot, you're going to lose something. You're going to lose a lot of money. You're going to suffer the consequences. That's a loss. and people are more sensitive to that. That's more persuasive. That would lead to the scare tactic in health promotion. You try to scare people. You warn people against the consequences if they don't change their behavior. According to the loss aversion theory, this is effective, more effective than the positive priming. People are more sensitive to loss than to gain. When you frame the message as a potential gain, and that's less likely to draw people's attention. So these are the key concepts that we are kind of using in formulating the research issue. And then another related concept is how you measure persuasiveness, how you measure attitude, basically. What we're using is a self-report. So we use the self-report. We ask people to report their commitment. Where was that? How likely for you to get vaccinated every year? That's commitment. How important it is for you to get a flu shot. How difficult or how easy it is to get a flu shot. These are self-reports, self-report of attitude and attitude change. And you want to discuss the pros and cons of this measurement. And this is measurement issue. After you have reviewed the key concepts in literature review, you want to formulate your question. What is the question? What is the question you are trying to kind of study? So, in other words, you want to ask that, what are the effective ways? You want to start with a broad question. Broad question being, what are the effective ways to persuade people to engage in health promoting behavior, such as getting the flu vaccination? And how do we persuade people to engage in this health promoting behavior? Exercising, getting flu shot, getting a mammograph, etc. And then you want to sharpen the question. So more specifically, we want to investigate how do we frame the message in order to be more persuasive, to get people change their behavior. And then there's a positive framing, negative framing. Is negative framing more effective than positive framing, or the other way around? And then we're also interested in how people's behavior influence their attitude. And there's a lot of research showing that behavior influence attitude more strongly than attitude influence behavior. And these are the research issues you want to explain. So after the research issues, after you introduce the key concepts, then you want to do your theory. You want to introduce your theory. What do you think? In this research, what is the theory you are trying to test? So basically, you want to, in your theory, you want to cover these topics. How would the message framing influence persuasiveness? And you have to write your own theory. You have to develop your own theory. Maybe you believe that positive framing is better. I believe, based on my understanding of the literature, I think positive framing is better. And negative framing, the scare tactics turn people off. That's one aspect. And another aspect of theory, that how would one's behavior influence one's attitude? Do you think those people who have already got the flu shot, they will have a better attitude or more positive attitude toward flu shot? Yeah, I believe so. Actually, this has been shown, this effect has been demonstrated over and over in the past. Maybe we want to replicate this effect. And then the most complex part of the theory is the interaction. What would you say about the interaction between framing and one's behavior? In other words, would positive versus negative framing have a different influence for people who have already been vaccinated or not? So maybe you want to ask a question that what is the effect of a framing? My answer is that it depends. It depends on whether you have already vaccinated or not. Well, I believe that for those people who are already vaccinated, those people who have already gotten the flu shot, doesn't matter. Doesn't matter to them. Well, actually, no matter how you frame the message as a gain or loss, they will have the same attitude toward getting a flu shot. They have already done that. They observe their behavior and they come to a conclusion. But for those people who have not vaccinated, who have not received the flu shot, these people are like the swing voters. In the election, you have the swing voters, they are undecided. They could go to get vaccinated or they could stay away from the vaccination. For these people, the framing will be effective, will be impactful. For these people, I believe that overall, a positive framing will be better than the negative framing. Basically, this theory is about the interaction. And if you look at the whole package of theory, your theory is based on a factorial design. After the theory, maybe you want to state the significance of the research. You want to explain that why this issue is important. Well, you can do that before the theory or after the theory. So the order is not really fixed. Maybe you want to first describe why is this research important. It is important in that, well, it helps us to understand how to promote health behavior, how to do a health promotion more effectively. And then after you, anyway, Audrey, do you have a question? You can speak.
Yes, Professor, I have a question.
Yeah.
In the theory, in the statement of theory, do we need to talk about the hypothesis as well, or is just that we talk about the theory statement and then we continue with the hypothesis?
Yeah, I would separate it. So first you will explain the theory, and then in the next part, you're ready for the hypothesis.
We cannot mix, we cannot elaborate them together, right?
I would keep them separate because with the theory, you can do the theory together with the literature review. And the literature review will give you the key concept. In the theory, you're talking about broad concepts. And the hypothesis is very specific. When you're talking, well, you can do it. It's not fixed. As long as you make it clear, as long as you make it understandable, it's okay. But usually, the hypothesis is closer to the research methodology because the hypothesis is very specific. It's tied to what you're going to do in the research. But the theory is more closely related with the literature review, the key concepts. Yeah, you have to try, you have to kind of experiment with it, tinker with it. Okay. So yeah, after you have explained the theory clearly, and then next part you can do the hypothesis. Yeah, based on my theory, what would be my predictions? Well, you can count, well, basically, depending on your theory, you can have 3 major predictions. One prediction, hypothesis one, be that what would you say about framing? Well, how would framing influence attitude overall? My theory would be that positive framing is more effective. And then my hypothesis is that if I frame the flu shot message, the publish as a public announcement as a gain, and then versus then a loss, people will have much better attitude towards flu shot. In other words, they're more committed, they show higher commitment level, they show more importance, perceived importance, and then they will show less difficulty. They would take the trip as less difficult. So overall, my prediction is that positive framing is more effective. Or if your theory is the opposite, and then you make the opposite prediction. And then the second part of the hypothesis be that would one's behavior matter? Yeah, this is an easy prediction. Well, my prediction is that according to the BAM behavior self-observation theory, those students who have already received the vaccination, they will have a stronger commitment, and they will have a stronger importance and lower difficulty in their attitude. And then the most complex prediction will be that, so your prediction is tied to what you are going to do in the study. So you have to mention the importance measure, you have to mention all this self-observation measurement. Yeah, the measurement issue, self-report. And then, well, the last hypothesis, the most complex that, my prediction that the effectiveness of the framing will be different between people who have received vaccination and people who have not received vaccination. My prediction is that for the people who have already received vaccination already, it doesn't matter how you frame the message of flu shots. Either way, they will have the same level of commitment, same level of perceived importance, and same level of perceived difficulty. But on the other hand, for those people who have not received vaccination already, for the swinner, for undecided people, I believe the positive framing will be more powerful in producing a positive attitude, stronger commitment, stronger importance, and less difficulty. And this is your prediction. And then after you have made the prediction, you are ready to test the prediction. The prediction will tell you how to do the study. And then the next part is the empirical observation. Basically, this is methodology. So you would have to state the subjects. I'm going to explain the subjects. You explain the subjects. These are undergraduate students. I didn't measure their gender. Most of them are female, but there are a few males. Psychology major, taking psychology courses, volunteer in the study. And then you explain the research design. So when you're doing this part, you want to refer to the original instrument. This is instruments, the study materials you are using, and you need to describe the materials and the instruments. Yeah. So here you explain the design, the materials, and the procedure. So in explaining the design, you will have to explain the variables. So you explain that in this study, we had one independent variable, that is the free mean. So how would you explain this variable? You that the researcher created two versions of a public service announcement promoting the healthy behavior of getting flu shot. The two versions differ in framing. One version framed the the outcome in a positive way. Again, if you get vaccinated, you will be free from the symptoms, from the coughs, from the medical costs, loss of work, etc. But the other version has a negative framing. So you explain this variable. And then another variable investigated is vaccination status. Basically, this is the subject's behavior. What is their behavior? Have they received vaccination? And you explain that this variable is not manipulated. We did not randomly assign some people to get vaccinated, some people to not get vaccinated. We just ask them. We ask them a question. Have you ever got vaccinated recently over the last 6 months? And this variable is called a differential variable. So differential, this is a differential variable, or you can call it a grouping variable. Well, both wording are okay. You divide people into two groups according to their vaccination status. But this is not an independent variable. And these are the two variables we started. One is independent variable. The other one is a differential variable. And then what are the outcome variables? Outcome variables, you can also call them dependent variables. So the dependent variable, we can call them collectively as persuasiveness. How persuasive the message is. We measure this variable with 3 self-report items. First, subjects were asked about their commitment, how committed you are in the near future to get vaccinated, importance and difficulty. This would be the research design, a research material. You can describe the research design and material together. Basically, the research design is implemented in the materials. And then you discuss the procedure. The procedure is straightforward. So subjects were college students doing a psychology class, and they randomly received one version of the questionnaire, positive versus negative. And then they completed the questionnaire as part of classroom demonstration. And then they completed the questionnaire anonymously. They did not write their name on the questionnaire. And then after they completed and turned in their questionnaire, they debrief. Debriefing means that the researcher explained the details of the study, the theory, the predictions, the expected outcome, etc. So that's a procedure. This will be the research methodology. We do a really simple methodology study. After you have completed the research methodology, you are ready for the data analysis. You are ready for the results. And this part is probably the most difficult part, the most involved part. How would you do the data analysis? What numbers would you analyze and report? So let's focus on this one. First, you look at the dependent measures. How you measure persuasiveness? Are they reliable? Do we have reliable and valid measures? And here, I'm going to give you a document. Remember last time I gave you the preliminary results. Now, I want to do the data analysis together with you, and you want to pay close attention. I want to explain to you how you analyze the data. I haven't posted this document in the portal yet, but after today's class, I will post it in the portal. So here, first, you want to summarize the subjects and the design. This one, you don't want to copy and paste my table to your paper. You want to describe in your words about what I'm showing you now. You don't want to use these tables directly. First of all, you want to explain the subjects. Altogether, there is 43 subjects. Actually, there's 63 subjects who completed all the studies. And so you can see that in the positive framing vaccinated group, there are 17 people. So 17 people were in the group that received a positive message and they are vaccinated. And 19 subjects who were in the positive framing group, they were not vaccinated. 10 people who were in the negative framing people, they were vaccinated. And 17 individuals who received the negative framing questionnaire, they were not vaccinated. So altogether, there's 63. Actually, there's 64 people. 64 people. Well, we are missing one data because one person did not answer the question whether you get vaccinated or not. So we are missing one person from here, and 63 people completed all questions. And that's a simple check of the subject, how many subjects you have. That's the first part of your result section, the participants. And then next, you want to look at the measures of persuasiveness. So how did we measure persuasiveness? We asked people 3 questions. The first question, so if we go back to the question briefly, how likely it is for you to get a flu vaccination every year starting from now? And this is commitment. The second question, how important it is? Important. The third question is difficulty. So we want to take a look at the correlations among these 3 questions here. Why do we care about correlations? Why do we need to look at the correlation of the 3 items? Anybody? Some ideas? We're trying to evaluate validity and reliability. So we're trying to say, we believe that these 3 items are all measuring persuasiveness. So these are 3 items measuring the construct, same construct, how persuasive your public service announcement message is. And if your message is really highly persuasive, people will have high commitment, high importance, and low difficulty. And is this the case? So we can see that commitment here, this is a good measurement. Commitment and importance. What is this number? Anybody tell me, what is this number? 0.544. 0.544. This is a correlation coefficient. Commitment and importance show a strong positive correlation. R is 0.44, and you have two little stars on top. What does that mean? That means correlation is significant at 0.01 level. Forget about two-tailed. It's a good. It is strong. It is very strong. So significant at 0.01 level. That is a highly strong correlation. What does that mean? That means that this number is not due to chance. It's not due to luck. There's a real correlation between commitment and importance. So between commitment and importance, reliable. These two measures of the persuasiveness, they give you consistent results. How about the difficulty? Commitment has a relation with difficulty as a negative. That's good sign. Negative 0.412. And again, you have these two little stars, significant, highly significant. And then commitment, importance, difficulty, they give relatively consistent results. So that means that they have relatively good reliability. And then if you look at so this is good sign, importance. Importance is highly related with commitment. So these two numbers are the same, the positive 544. Why? Because they have the same correlation. They've got the same correlation between these two variables. But importance has a weaker correlation with difficulty. Weaker. Anybody can tell me, is this significant? The importance has a negative. The negative is good. The more important you think it is to get vaccinated, the less difficult you think it is to get vaccinated. But if it's negative 0.208, statistically significant. No, it's weak. Why not? Because we don't have any little stars on top here. We don't have any little stars at all. So it's not significant. So importance is kind of the direction is good, but the real correlation is kind of weak. And here we covered everything. The difficulty has a strong, has really kind of a difficulty, has a negative correlation with some commitment. These two numbers are the same. Negative 412, negative 412, same measures. So overall it's good, but the difficulty seems to be kind of have a weaker correlation with importance. Why? Well, maybe one possibility that the difficulty is not measuring persuasiveness. So the question about asking how easy or not easy it is for you to get vaccinated, maybe that's not, this item is not good a measure of how persuasive people are. So how difficult it is for me to get vaccinated, maybe it's not about how persuasive the message is. It's more determined by reality. So reality, if it's really easy, it's easy for me. It's really difficult, it's difficult for me. Yeah, so maybe the validity of this item is a little bit lower. Yeah, so you look at this this kind of a correlation table, and then you write about your conclusions. Overall, consistency or reliability is good, but there's maybe some questions about the last question, difficulty, how difficult it is. Is that a good measurement of persuasiveness? That's a little bit questionable. And then, well, let's take a break. Let's take a 10-minute, let's take a 7 minutes break. Come back at 1:30. Take bathroom break. I need to rush to the bathroom.